Hi, my name is Michelle Levine. I'm a nursing student at ECPI University. I am currently in a master's program and studying population health. The assignment I have for today is to look at the American Public Health Association website, and in particular look at the Affordable Care Act and its effect on my public health indicator. For my health promotion project, I'm specifically looking at mental health illness disparities. So before I get to the Affordable Care Act, what I'd like to do is first mention that the Mental Health Parity Law went into legislation in 1996, specifying that health insurance plans needed to cover both mental health and substance abuse care services, in addition for any kind of treatment for physical ailments. In 2008, they expanded that law to also include addiction problems. In particular, what this law states is that you can't have higher copays and deductibles for mental health and substance abuse treatment than you would for those seeking treatment for physical symptoms. Now going to the Affordable Care Act. In 2014, the Affordable Care Act made one of the largest expansions of mental health and substance use disorder coverage in a generation. Basically, what this law stated is that the new small group and individual market plans are required to cover the 10 essential health benefit categories, which include both mental health and substance abuse disorder services. And in addition, they're required to cover them at the parity of medical and surgical benefits. So essentially that this basically builds on the Mental Health Parity Act in stating that mental health and substance abuse disorder services need to be covered equally to those services that would be provided to a patient receiving medical or surgical benefits. It is thought that about 62 million Americans were affected by this act that went into law in 2014. The final rule implemented the Essential Health Benefits directing non-grandfathered health plans in individual and small group markets to cover mental health and substance abuse disorder services, as well as to comply with the federal parity law requirements beginning January of 2014. So considering this big statement that was made by the Affordable Care Act, I would most definitely say that I feel like the Affordable Care Act has been very successful and helpful at trying to improve the access to care for those who have mental health illnesses, and also to improve the stigma of those with mental illness. Thank you so much for your time.